This is far too kind. Let me add a disclaimer to the very, very kind words of Harry. We would have liked somebody else to be here. Really, there are few researchers that are looking into the issue of prevention and gender, and but we did not manage to bring them here. So you will have to do with me. I am not a researcher, but I have been working a lot to try and bring research out in the world and out to the policymaker and practitioner worlds. So I'm hoping that some of the magic of our researcher colleagues is also a bit on me. And my presentation is will be fairly simple. I'm sorry I did not correct my opening slides. We have published some guidelines on prevention, treatment, and rehabilitation for girls and women, but today I will talk only about prevention. This gives you a little bit of context. This is the work of our colleagues in UNODC that do the World Drug Report. And that gives you an idea of the imbalance that there is among the numbers of men and boys and men that report using drugs and women. And the thing to notice here is that for cannabis, forget it. For cannabis, cocaine, and ATS, there is quite an imbalance. For every woman that uses, 3 men do. But for tranquilizer and prescription opioids, this imbalance, correct itself is not the right word, becomes much, much smaller. These are, again, 2 pictures from the World Drug Reports, and they give you an idea on how this imbalance, more or less, repeats itself in different regions. And again, we see a much more marked imbalance in cannabis, cocaine, and amphetamine, and less so with regard to tranquilizers. And this matters because we know that women who use drugs face a higher barrier to accessing treatment services. And this is just an example, again, from the World Drug Report. If 1 woman and 3 men actually need treatment, what we will find in treatment is 1 woman and 5 men. So we do see in practice that women do access treatment less, and we do know that they suffer from higher stigma and discrimination. And so it would be really, really great if we had something to prevent drug use and drug use disorders among women and as well as of men. And the question, so this is where we started, and the question is like, well, but do prevention programs actually have a different impact on girls rather than boys? We didn't really know, and so we started working with Professor Kumpfe at Utah State and her group. And so we went through all of those prevention programs that have been put in one of the 3 main registries of evidence-based prevention programs. Largely, there are 3. There is the NREP and the Blueprint, I think it's called. Both are based in the US, and then EDRA here in Europe. We looked at whether they were reporting data disaggregated by sex. Actually, we found very little, but we were not discouraged, and we wrote to all of the programs. It's like, please, if you do have some data that is disaggregated by sex, even if it was not published, please do share it with us. This is what we found, which is a tiny bit discouraging. The green is the programs that are not providing results disaggregated by sex, and the dark brown is the programs that do provide results disaggregated by sex. I think it's very clear that the vast majority of programs, of prevention programs, don't even look if they are having a different impact on girls or on boys. And remember that these are programs that have been evaluated, which we know are themselves a minority of all of the prevention programs that are out there. Still, we did find something, is this small 5%, and we wanted to look so we looked what is the different impact, if any. So, on the basis of the little evidence that we have, and I underline little, I think we can say that there are some indications that prevention programs do not have necessarily the same effects on boys as on girls. In these slides, the first pillar summarizes school and community programs. The second one is family-based programs. The last one is everybody together. And the dark green is programs that had results that were more positive for girls than boys, and the light green is programs that reported results positive for both. And you can see there is a good quantity of those, and particularly with regard to the family-based programs. But you can also see that there are red programs, so that are positive for boys and have no effects for girls. And there are even dark red programs, so that are positive for boys and negative for girls. They're a minority, but they are out there. And I use this slide as a red flag. We cannot assume that our prevention programs have the same effect on boys and girls. And in fact, we need to study more. Another thing that I noticed very tentatively in this slide is the fact that with school and communities, there appear to be more programs that are not so good for girls and than with family-based programs. And I want to show you a couple of slides that would illustrate this. This is, for example, again, adapted from the World Drug Report. The World Drug Report this year had one entire part of the first chapter that was only about evidence-based prevention. And this is from a family-based intervention and particularly a strengthening family program. And as you can see, in both cases, we end up having a good difference. The red is the control group that did not have the intervention. The green is the group of kids that did go through the intervention. The intervention was provided when the children were 13, 14, and the children were followed up until, well, they were by then young adults of 17, 18. And in both cases, we have a good result. This is an example from a school-based intervention, and I think this is the third time today that you see the slide on the left, because this is from the good behavior game, and this is what Professor Kellum Professor Foxcroft before me were presenting before. The amazing results that good behavior games has for boys, and the great things of having more results for children that are particularly at risk, and being able to do so in a way that is non-discriminatory, that doesn't say you are very aggressive, come with me and I do a special program with me. No, through a universal program, really addressing a very, very strong risk factor. But for the girls, that in that same risk group, there was not such a strong effect. There was not a detrimental effect. Correct me if I'm wrong, Professor, but the effect was not so spectacular as in the case of the boys. This is a bit, I missed some slides at the beginning. This is a bit consistent with the little that we know about why girls start to use drugs and or substances, and how this differ from boys. Largely, many risk factors are the same, but there are some risk factors that appear to be more relevant in the case of girls: low self-esteem, concerns with body image, and particularly problems with families. The influence of peers is as powerful in boys and girls, but it tends to be expressed differently. And of course, girls are unfortunately at higher risk of victimization of sexual abuse, and that is an enormous risk factor. This is an old slide from Professor Kumpfer, and it created a long time ago, before the advances in neuroscience and genetics that we heard about this morning. But I think it does summarize nicely in these cases, they are protective factors, the factors that are linked to no substance use. And in general, from these slides, you have to think that the thicker the arrow, the stronger that link there. And as you can see, family bonding that leads to good family supervision and positive family and peer norms is fairly thick, and is the thickest one, and is the most important ones leading to substance use. Family bonding is also extremely important to support academic self-efficacy, and that leading then to, again, positive family and peer norms that leads to no substance use. And for you, I have marked in light yellow the places where this is stronger for girls than for boys. And as you can see, they're mostly on the family. While for boys, social community and prevention environment, and then the role of self-control are slightly more important to get to that result of less substance use. Therefore, I think that this kind of indication that is coming from the very little evidence that we have, that family programs appear to be, family-based programs can be more consistently positive for girls as well as for boys, is also consistent a bit with the indications that come from etiology. When my title slide called guidelines, it was called guidelines because this is the title of the document that we have. But I think that I cannot say that I have guidelines for you. I think I have some suggestions, some indications. And I think that the first one I've already mentioned: do not presume that your prevention program will work as well for boys as for girls. Evaluate the impact of drug prevention intervention and disaggregate the results by sex. This, by the way, means investment, because it means that you need to have a good sample to be able to run this statistical analysis. It's not something that happened by itself, but see it as part of the conscious investment in the well-being of youth and children that you are doing through prevention. You might want to consider to go for parenting skills. I already mentioned why. And then we need more development. We need development of programs that respond to the unique vulnerability of girls. I've listed some here. We also need more research on the unique vulnerability of girls to inform such a more applied research. I think I'm done. Yes, thank you very much.